the coronavirus. How are community groups helping those in need? Disparities in healthcare, its lethal impact in the Black and brown communities, and a chat with County Council Vice Chair about COVID-19. It's time to wake up.
Today we are joined by community advocate Angum Check from the Prince George's County Mutual Aid Fund, Delegate Jocelyn Pena-Melnyk from the 21st District of Maryland, and Prince George's County Council Member at Large, Council Vice Chair Calvin Hawkins. Our first guest, Angum Check. Thank you for coming on. How are you?
I'm good. Thank y'all for having me. Hi, it's Angum.
Yes, and
Hi, Angum.
So you've been a community advocate and organizer in Maryland for several years. Tell us a little bit about you and how did you get into this line of work? So, and also, what does Prince George's County Mutual Aid Fund mean to you?
Yes. So thank y'all for having me. I have been an organizer for almost 5 years now. However, most of that work and experience was in North Carolina. I was raised in Prince George's County. This is where I've lived since I immigrated from Cameroon at the age of 7. So this is really my home, and I just moved back after college and began really diving into the community work here since July of 2019. So super excited to be building with my home and my community. As far as the PG Mutual Aid network, that really grew out of a bunch of folks who were connected to the DC Mutual Aid network, seeing a need in Prince George's County, knowing that this coronavirus is causing a lot of financial insecurity, a lot of hardship with getting basic necessities like food and cleaning supplies. And so really wanting to take the model of mutual aid and community solidarity and apply that to PG County to meet the needs of folks who are most vulnerable within our community.
Awesome.
Okay. Well, it sounds like you already really touched on the next question I had. The Mutual Aid Fund, what are you guys doing to assist the residents of Prince George's County that are impacted by COVID-19?
Yes, thank you for asking that. So we officially just call ourselves the PG Mutual Aid, and our main focus is really meeting the basic necessities of folks in our community. So the basic necessities are food, cleaning supplies in this time, things like paper towels, toilet papers, and so how we operate is there is a group of volunteers, folks who fill different roles, and we have a hotline and online form as well for people to request aid. So yes, we are focusing on meeting those basic needs of food and cleaning supplies and sanitation supplies, but there are also things people's access, like, hey, I need help with filing for insurance, or hey, I need help with getting my medication. So we offer those types of services as well, and have been just trying to meet requests as they come in.
Okay. Awesome.
That's great. That's great. Angum, so you touched on this, but we just want a little bit more clarity. What are the top priorities for Prince George's Mutual Aid Fund? And then how do you see the fund continuing in the future, like past the coronavirus? We know that there are always going to be some sort of need for aid within the county. So, can you touch on that?
Yes. So the top priorities right now, as I mentioned, one is meeting basic necessities. Two is also connecting people to other resources. So we have folks come to us for things like rent support, immigration lawyer support, and we don't necessarily have the infrastructure or the history and resources to provide everything. So we are trying to build a network and a list of other resources that we can connect people to. So one, meet their basic needs, and if we can't meet those needs, have a system to direct people to other resources. Likewise, our other goal is to really build community solidarity and interconnectedness. So really trying to promote neighborhood pod models and people, connecting with their neighbors to see what resources they can pull from those areas, and really making sure that we do more work, like, fun events, things that really have the community connecting to each other. So we want to build more of that as well. Those are some of our priorities. We're also really concerned with the question of how do we use this mutual aid network to push our representatives, our officials, to meet the needs that the mutual aid is providing. So really raising this crisis as a public health issue, and calling for decarceration of jails, because that only furthers infections. Really pushing our local electeds to also adequately respond to the crisis that we're in.
Awesome.
Absolutely.
And so we just want to thank you for coming on. And one final question, how can people get in contact with you? I'm pretty sure there's, tons of people who are going to need some assistance. How can they get in touch with you?
Yes. Sorry, I'm looking down on my phone just to have all the accurate information. But you can call our hotline at 301-485-9033. Again, that's 301-485-9033. And you can call this hotline to both request aid and to let us know if you have any donations. We really need donations from the community. So non-perishable food, all those things. You
Are
can
you guys
also email
actively
us.
seeking volunteers?
Yes, we are also actively seeking volunteers. And so you can reach out to us at pgcountymutualaid@gmail.com. We also have a form that you can fill out if you are requesting aid or if you are looking to donate and volunteer for us. And you can find those out on our social media as well, PG County Mutual Aid, both Twitter, Facebook, and Instagram.
Awesome.
Thank you.
Well, again, thank you so much for coming on. Welcome back. We're joined by the delegate of the 21st District, the Honorable Delegate Pena-Melnyk, Vice Chair of the Health and Government Operations Committee. Welcome, Delegate. Give the viewers a peek of your district. Tell us about the mighty 21st and some of the things you're doing in your community for COVID.
Thank you so much for having me. I want to thank the three of you for, taking the time to report on issues that our communities care about. I'm really grateful. So I represent the 21st District, which is two counties, Anne Arundel County and gorgeous Prince George's County. And the 21st, it's College Park. It is actually Adelphi. It is Beltsville. It is Laurel, Calverton, Vansville. And then we go to Anne Arundel County, where we represent Gainbrills, when we represent Odenton, Piney Orchard. So it's quite a diverse district. It's about 127,000 people, more or less. And I sit, as you stated, on the health committee. So a lot of the policies that I work are health related, right? I am the chair of the subcommittee on public health and minority disparities. So the pandemic we have right now, it's something that is really important to our committee and that we're doing a lot of work on.
Exactly, and I can completely understand the need to fortify and make sure that we respond to this very carefully and diligently and also effectively. In your opinion, what's something that your community may work on for the future to respond for incidents such as this?
Well, we know, and our committee has already done a lot of work on health disparities, right? Mm-hmm. Something that this pandemic has shown is the gaps, right? And how it has really impacted the African American community and the Hispanic community. So for example, as of today, we have 16,666 cases, and the people of color represent 56% of those confirmed cases that are positive. And African Americans particularly are being hit really hard, where 6,046 of us have been positive. And we a lot of our people, especially the Black males, are dying from the disease. So this is a disease that have really impacted us the most because we have a lot of racial and a lot of economic disparities. Our people have had a lot of generation of poverty. Our people take public transportation. We work with the
Yeah.
public. We don't have access to health care. There's a lot of differences, and we know they're there. We don't have to spend another penny studying it. We know they exist, but we need to figure out where the gaps are and what are the resources that we're going to put into our communities to make sure that this doesn't happen again. And we have to make sure that we don't have a short-term memory and we're in the news for 2 or 3 days, and then when this is done we do nothing about it. This is something really important,
Yeah.
and the data speaks for itself.
And that really brings me to my next point. Delegate, how do we ensure that everyone receives the best treatment possible and not come at a high price? Typically, Black and brown people traditionally lack resources, and this subgroup appears to get hit harder and bear an even larger cost outside of a pandemic.
So in Maryland right now, if you do not have a primary doctor and you don't have insurance, you call your health officer. So we have 24 health officers in the state of Maryland. So you call, we live in Prince George's County, Dr. Carter's office. They have to speak with you. There's a hotline. They screen you. If you go get the test, it is free. If you end up in a hospital and you're not able to pay, you can apply for Medicaid, which is our state public insurance. But most importantly, many people are not aware of this, that every hospital in our state, we have a law that we pass. And recently we passed one this session that they must offer charity care and financial assistance. So if you cannot pay, you have access to that. You can apply and you will be able to get it free or very low cost. It will be reduced. So you have the Maryland Health Benefit Exchange. And if you call the Maryland Health Benefit Exchange, they'll screen you. And if you cannot pay, you then will get Medicaid if you qualify. So there's a lot of different options. I don't think people need to worry about the cost because the state will step up. What you need to do is to take care of yourself, stay home, make sure you get tested. And in our Black and brown community, we need to trace, the disease. We need to make sure that everyone is being tested ultimately, because again, it is affecting us greatly.
Absolutely. And a lot of it is about getting the information out there.
That's correct.
And just since you're here, what are your thoughts on the Laurel Hospital reopening to respond to the pandemic?
It's funny because I was one of the people that fought very hard not to have that hospital closed because there's a need in our community. And, especially when you talk about pregnant women giving birth, I mean, it's important to have those options. And it closed. It did reopen. It's going to have 100 and something beds, especially for the coronavirus. It is really a good idea because it can sort of relieve, the stress that other hospitals in our area have. So I'm very pleased. And they opened the day before yesterday, and they're really functioning.
So something that's been kind of on people's minds is that once the order is lifted in relation to evictions, that essentially those who could not afford to pay their rent during this time will automatically and quite frankly immediately receive eviction notices, and that their management companies will go through and try to evict them. So, how are we going to address that? Is there anything being thought of or being done in relation to addressing that once the courts reopen and these individuals, are still struggling during this time?
Well, it's interesting that you say that because I represent Anne Arundel in Prince George's. So on April 15th, County Executive Stuart Pittman from Anne Arundel County announced a new eviction prevention program that will help renters that are struggling to pay their rent or utility bills because of their recent job loss or employment disruption. And this is really important because a lot of people are going to have a bigger problem of, owing months of arrears and late fees. So the program will provide temporary assistance to households of income up to 80% of the area median income. And it will basically help them pay for their bills. And I think that if Anne Arundel County can do that at a local level, then we should be able to do it statewide.
Exactly.
Because we have 24 counties, and you shouldn't just live in Anne Arundel and have that benefit, and then live in Prince George's or Montgomery and not be able to have that benefit either. So people are already thinking about that. It is important because when this is done, a lot of people are going to be in a lot of debt. And that will be, again, we can see what being in debt and generational, poverty can do to us, especially particularly people of color. It will be very difficult to recover. So we should have these programs. We need to think outside the box. And if Anne Arundel can do it, so can Prince George's.
Oh, absolutely. And I definitely believe that there is something that we can do because we have to take people over the interests of money and everything else. Thank you for your time, Delegate Pena-Melnyk. We appreciate you so much for coming on and hopefully look forward to seeing you in studio when outside reopens. Do you have any last words before we let you continue to your social distancing at home?
Thank you. Thank you. I appreciate all of you for caring. This is an issue that us as communities of color, we need to keep the pressure on us, legislators, on the governor's office, the Department of Health, to make sure that the data is collected on Black and Brown people, to make sure that we have, they're going to issue an RFP to choose a vendor. The state is, I just learned this week, that is going to hire something like 1,000 people that will do the contact tracing, which is very important in our communities. We want to make sure that those people that are hired look like all of us and can, represent us, which is very important. And we have to make sure that, as we look at our small businesses and the grants and loans that are also being given, that our communities can benefit from that also. So we have to be vigilant, and this is going to be around for a while. So information is powerful, and we have to find it, and we have to make sure that we communicate clearly. So thank you for doing this. I really appreciate it.
Awesome. Well, don't go anywhere because there's more for where that came from. Again, thank you, Delegate, and we'll see you soon.
Bye,
Thank you. Have a blessed day. Thank you so much.
See you soon.
Thank you. Bye-bye.
Welcome back. Our final guest for today is County Council Vice Chair Calvin Hawkins. Thank you for joining us today. Councilman Hawkins, how are you?
I am doing well, thank you.
Awesome. Can you tell us a little bit about yourself and what it's like being a member at large during the COVID crisis?
Oh, I grew up in Prince George's County over in the Glass Manor area of Oxon Hill High School. Having an opportunity to serve on the county council has been a rewarding experience because it gives me a better opportunity to serve and help the citizens of Prince George's County. I never knew my 16 years as a member of the emergency management office in Prince George's County would allow me to use my skills and training as an elected official. So I welcome this opportunity to lead and serve because I have the background in emergency management to help with how we respond and mitigate this COVID-19 pandemic in the county.
And so also just to pivot a little bit, because we know businesses are extremely important, but also our most vulnerable populations are important as well. I know that you sit and you are on the board of the committee for reentry of citizens within Prince George's County.
Yes.
So I was wondering if you could, give us just kind of a few kind of updates on what has been done or what are the measures being put in place to help the incarcerated populations and those on pretrial, and just kind of how are we also helping citizens of reentry just in general.
I'm glad you asked that question. Just this morning on a call with the Inner Beltway Coalition, State's Attorney Alsabrook said about 100 individuals have been released from the county detention facility as a result of this pandemic we're experiencing, and based on the charge that was holding them in there. As for what I've been doing, I've been very active. Just recently, as 3 days ago, I spoke with County Exec Alsabrook as well as her Deputy Chief Administrative Officer for Public Safety, Mr. McGaw, and I asked the question, and I asked it clearly, what is going on? Because my office received like 3 emails with inmates saying that there was a COVID outbreak there, and they were not getting the type of treatment and the type of care that will prevent them from getting the COVID-19 virus. But they assured me each day that they are working to ensure that not only the men and women who work in the detention facility, those individuals who are detained there are getting the ultimate care. Just so you know, next Wednesday, I'm planning to do a tour of the detention facility to see for myself what is going on. And I requested to have the opportunity to talk to some of the individuals detained there, not who they select, but as we walk around, I will stop and ask questions, and I want the opportunity for the men and women we see to answer them without any fear of any negative repercussions.
So about April 28th or so that you're going to do that tour.
Yes.
Okay. And we look forward to hearing back to you on those findings.
Come back.
Absolutely.
And even Kiana Johnson and some of those will tell you last weekend they had a case where some individuals could not get out, because you all may have known it was national release or get individuals out of prison or detention centers. And I worked with them late into the night getting 2 individuals out that they had posted bail for. So as one who's been on that other side, I know the importance of having people fighting for your freedom, and I will never get in the way of anyone that's helping and advocating for freedom and liberation of those who are incarcerated.
So while we're on this subject, I do have a question about pretrial. How is that being handled right now? Are we, ensuring that a speedy process is occurring for that as well?
Yes, they're doing it virtually, quite honestly. The attorneys are, instead of the individuals coming into the courthouse, there is virtual. They are actually having virtual hearings with the judge. And I must tell you, it's based on the constitutionality of who they need to hear, who they could delay. But yes, that process is still going on, thank God.
Okay.
And we definitely appreciate you and applaud you for doing that work and due diligence. Council member, I just wanted to know if you had any insight. I was curious what the county was doing directly to help the homeless population in the county, and especially we have a large LGBT plus community, and additionally, how are the shelters responding to social distancing?
That's a good question. Let me start from the back of your question and go to the beginning of it. We have been checking on, not me personally, but our Department of Social Services and our Department of Family Services. I understand that they have been working with the shelters, seeing how they're creating social distancing, but not only making certain that they have what they need to take care of their population as far as their hygiene and ensuring that they get some healthy meals. As far as the LGBT community, I haven't really worked with them, but it's a community that at the end of next week, my team, as we promote We All Rise Together, it is the LGBT community as well as the homeless population that you asked about and our veterans that I want to focus on as far as ensuring not only do they have food, but how we dealing with the homeless in this crisis, how we checking them to ensure that they are not positive, and how we convince the LGBT community to get more engaged and help them, particularly, as you all know, after what happened last year or early part of this year over there in the Fairmont Heights area. I want to make certain that what they're dealing with doesn't go to the back burner and that their concerns are just as a high priority as everyone else. And if you all have, after this show, if you have any ideas or recommendations that we could pursue in touching them and getting to them, please don't hesitate, because we're all in this together. We have different titles, but our commitment to serve is no different than one with a title or elected title or whatever. We are in it together. And I know you all from my work with you that you're committed and you're going to hold me and everyone else accountable. And I want to work with you in any way I can to ensure that we are doing what we're supposed to do in this very hectic time.
Exactly. And
we do have
we're running out of...
we do have a very active, I'm sorry, Sherman. I just wanted to say we do have a very active LGBTQ plus community during this time. They have been very active within Prince George's County, and Crystal Orietta and her wife Cassie also are over the Dignity Project, and you can reach out to them directly in relation to continuing to support our LGBTQ community.
Okay.
And I'm glad you
so
brought
that group
that
is
up.
called the LGBT Dignity Project, and we are running out of time. We can definitely talk about that later. I just wanted to get you with one final thought to close out, as well as I did want to see if you can highlight really quick any crime rates. Has it gone up or down, or anything about domestic violence while COVID is in process? And then close us out with a message.
Our crime rate, believe it or not, is going down, but unfortunately, our domestic crisis and our domestic challenges, our domestic violence is not only high here in the county, in the whole DMV. And so Chief Stawinski, our whole social services network is working, as you see, Angela, County Executive also Brooks, promoting how, about this domestic violence. Our calls are going high. We actually added some more people to the crisis intervention staff to help with the calls and encourage anyone that's dealing with domestic violence to call. And I want, because of what you all are doing, I would love to find out through you, Martin or Janna, that how we can help you with what you're doing there. Some funding opportunities through my office and the other council members' office, but I can't speak about them. I can only speak about mine. If some of the work you all are doing, if there's some funding during this time, I can help and get to you, because you're out there on the front line. I want to do that. I want you to hold me to that. And within the next few days, let's talk about how we make that a reality so you can help some of the people that you need to help with what you're doing.
Yes, awesome. And you heard it here on first on the Wake Up. Thank you for joining us today, Councilman, and we hope to see you in studio when outside opens again.
I look forward to it. Please continue to do the great work you all are doing. And God bless you. Together we rise together.
Thank you for joining us today on the Wake Up. I'm Sherman Hardy with my co-host Janna Parker and Martin Mitchell. Prince George's, stay safe, stay strong, stop sleepwalking, and wake up.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.